And the other thing that I say, to parents, like you said, it's almost like creating a movie, right? It's almost like, I'm coming in and I'm a director, right? And I have a vision and I know what I want to do and I know how I want my movie to go. And I've hired Rebecca, my movie star. She looks great. She knows what she's doing. But I really want to direct her really hard. And I can to some extent, but ultimately I've hired her because I trust her. I know she's going to be able to really shine in this movie. So I say to parents, step behind the scenes. Get behind the scenes. You're not in front of the cameras. Let your surrogate movie star do what she does. I think.
Hi, everyone. Welcome back to the Surrogate Buzz. Today, we are going to be talking about the emotional readiness and psychological support in surrogacy. And we will be joined by Dr. Stephen Covelluzzi to help us understand this psych situation in surrogacy and how to best advise on what to expect during that process. So, but don't forget to like, subscribe, and comment. Dr. Covelluzzi.
Hi, Rebecca.
Thank you so much for joining us.
You're welcome. Happy
This
to be
is
here.
such a hot topic.
It sure is. A lot going on. That is for sure.
And I feel like, this is obviously there's a lot of steps in the process, but I feel like sometimes this psych process is a little nerve-wracking for people.
Overwhelming. It's scary to be told you need to meet with a psychologist. I just want to have a baby. Like, why do I have to meet with this person? I get it.
Yeah,
I totally
but
get it.
as we know, doing this every day, there is a lot that goes into the entire journey. And this is probably the first stepping stone that really just makes a lot of sense and needs to be done.
Yeah, I think it opens up a pathway of a conversation to have, before you go through this process, because there's so many, I'd say, underlying emotions that people, sometimes arrive with. And I think it's good to uncover that and to make sure that people are well aware before they move forward in that process. So.
For sure. So before we kind of dive into all these fun questions about the psych process, can you share what drew you into this work and why psychological evaluations are so important for a third party?
Yeah, it's a great question. So I've been in psychology, 25 years at this point. And so primarily, I specialized in children, adolescents, and families over the years. And so I've had the gamut of, everything when it comes to children, families, et cetera. And then about 10 years or so ago, I decided to go through this process of having children through surrogacy. And so as a result of my own personal process, I decided to open my clinical practice up to helping other couples, surrogates, parents, et cetera, navigating this process. I thought, at the time that I could really put my spin on, my own experience, but also share all of my professional background to help other people, couples, and surrogates going through the process. So that's how I got interested in it. And it's been almost, 9 years at this point, and I absolutely love every single day. I continue to learn something new every single day. But I think that every person I meet from all over the world continues to teach me something, and it's just fascinating.
Yeah. And did you get into it and switch your gears because you saw something that was needed or something that was faulty?
I did. I saw all of it. I definitely saw all of it. I think I saw, and this is almost 9 years ago. So the field's changed a lot and it's evolved a lot. Technology's really caught up. But, as a person navigating it myself, I thought, I see a little, this can get cleaned up, or this could be sharpened, or, I think we can really help parents with this, not to infer my own, personal experience, but, just broader brushstrokes by allowing people to feel confident and comfortable going through that process. And so, yes, to answer your question, I saw areas of improvement, areas that were done really well, and areas that I think I wanted to help introduce, something that we'll talk about a little bit later, like that group meeting that we're doing, I think is really important.
So why do you think it's so important for us to do a psych evaluation for the third party process?
Well, first of all, I'm so glad that you have elected to do that. There are some, we'll say, not every parent goes through it. So I think it's really, really, really important to just emotionally prepare parents for the landscape of what's about to happen. Hopefully, some cases take a little bit longer, some a little bit shorter, but what we don't ultimately know is what parents are arriving to the surrogacy journey with. There's presumably a lot of trauma, years of fertility loss, hurt. Sometimes, obviously, there's miscarriage, and then some people arrive with 4, 5, 6 children. They just want to really expand their family. So I never know that going into it. So I think it's really important to assess where each person is, but also the other thing that I've learned over the years is, a person's culture and their background really dictates how I think they're going to handle the surrogacy journey too. So it's a combination of assessing what their background is psychologically, but also what culture and how they communicate, all that sort of stuff at the beginning.
Well, yeah, I mean, there's a lot of different factors that come into not just the surrogacy journey, why they're here, but also the cultural differences,
Correct.
which can arise as well with a match, right?
Absolutely. There's nuance in culture. People, some cultures are very quiet, some are a little bit more assertive,
Yeah.
some don't talk about that. And so, I come into the picture saying, hey guys, let's talk about everything in advance, because I truly believe that the more you can bring to this first date when you're matching with your surrogate, you really can open up the pathways to create a cohesive experience. So
Yeah.
I think the more the better.
And that comes with the transparency up front, right?
Yes.
Hey, just lay it out on the line
Yep.
and tell us why you're coming here and what you have to give and maybe what the issues are that you come with, right?
Or what you're scared of, and what
Yeah.
you're maybe not even ashamed to talk about. But it's like I say, it's like going on a first date, and sometimes we make ourselves look really pretty, and we don't talk about those things. But I'm here saying, look, yeah, you're going on that first date, but I really do want you to bring everything to the table and show everything, because that's ultimately how your agency can help shine. That's how they can help match you with the perfect candidate, so that that person can join with you and support you throughout the journey.
Yeah, exactly. So what are the most common emotional themes that you hear from intended parents
Oh,
before
boy.
or when they're starting their match?
Well, there's a lot going on there. It depends. It depends because if I'm working with a single person, if I'm working with a same-sex couple, if I'm working with an opposite-sex couple, or there's a lot of different
Yeah.
things. But I think obviously the commonality is they would love to have a family. They would love to have a child. So whatever that looks like, it looks like. And I think, the themes of hope, concern, excitement, all of that is kind of there. And then I think that it transitions to, well, how is this going to go? I've spoken to a friend who did it, and they had this experience, and they said it's going to go like this. And I'm saying, okay, well, it may not always go like that. Every experience is different. So the themes are, I'd say, hope, excitement, some being a little bit scared sometimes, but just wanting to really match with the right person.
So you're kind of managing expectations.
A lot.
Yeah.
Yeah, a lot.
Where it's like, okay, because I feel like a lot of people do come into this journey. Maybe they got referred by somebody like you mentioned, or they know somebody who's gone through it, or maybe they are on social media and they've seen it,
Yeah.
And I think everybody hopes and prays that, okay, it's going to take on the first try. We're going to get matched with this, one surrogate, and we're going to have this, beautiful rainbows and
Flawless
unicorns.
journey, right?
Yeah. But it doesn't always happen like that. And so it kind of starts obviously with us. As the agency kind of matching and things like that. But then it goes to you, right? As a psychologist, like, okay, hey, listen, we're, gonna
We're going to
see how this works.
gonna
And we're going to
talk.
meet with you, and we're going to
Yeah.
meet with your surrogate, and then we're going to meet all together.
And it's hard because, you're doing a lot of these really complex processes at the very beginning, even before somebody's matched, really, right? And so you have to draw back on what you said. We are, I'm helping parents manage their expectations, to be psychologically resilient, to have, the preparedness of, anything's possible. And some parents arrive with only one embryo, or some
Yeah.
parents only have, a couple. And so there's a lot of fear,
Fear,
so
yeah.
there's a lot of fear associated. This is going to work. Oh my gosh, if it doesn't, is this my only one and done? And so part of what I'm doing too is assessing, why they're coming to surrogacy and what's happening. Has it been, years of fertility trauma? Is it, now is just the right time? And so it's more so about assessing what they're coming to surrogacy with, and then being able to help them navigate that pathway, what that looks like forward.
Right. Yeah. So I think whether you're on the IP or the surrogate side, I think the psychological evaluation is very stressful for people.
Yeah.
Obviously, for the intended parents,
Yeah.
it's like, well, why do I need to be, evaluated, or why do we need this? Not only does the IVF clinic require it, but so
Yeah.
does the agency. And then on the surrogate side, it's like, okay, what are they going to ask
What are
me?
they
And
gonna
so
ask?
there's a lot of
Unknown. There's a lot of unknown.
there's a lot of
right?
unknown, and I think that it even more so than the medical
Yeah.
piece, people are very hesitant and maybe scared about that. So can you explain in simple terms
Yeah.
what an evaluation
Yeah.
in surrogacy looks like, and what is
Yeah. So that's an
Normal.
interesting. Yeah, no, it's a great question though. So that's the first word I try to pull back from. I think that because I'm not formally treating anybody, I don't call it an evaluation. I call it a consultation
Right.
because they're coming in and everyone says, "Did you fail? Did you?" It's like it's not a pass fail situation. It's a let's come to see how educated you are about this process and how I can bring you up to speed about what may happen. So it's a consultation is really what I say. And so what people can expect is just to have a conversation about the surrogacy process from start to finish, and about, creating a pathway to connect with your surrogate. Because I think, in my experience, I think that getting to know your surrogate, even ahead of time, can be really, really, really beneficial to
Absolutely.
reducing that fear, anxiety, and ultimately what we're doing here over the course of this meeting is for me to assess, can this person trust another human and what that looks like for them, and then allow them the opportunity to share that with their agency or with their surrogate so that they can choose the correct candidate for them, because we really want everybody to feel supported.
Yeah.
And so they can only do that if they're open and share. So I start with a gentle opening, and then I kind of guide people through. The ASRM does have guidelines that I do touch on, of course. And so when I'm meeting with parents, I tell them in advance. I kind of give them a syllabus. I say, this is what you can expect from the meeting. You're not in school. I'm not formally assessing you. I'm going to talk with you about who you are as a person, just get to know you really quickly. And then we're going to address some psych questions. I'll have to kind of do a little bit of poking and prodding and seeing, what's going on under there. And then we'll get into the rest of your journey, depending on if you're working with donor embryos or your own genetics. And then we'll spend the bulk of our time talking about surrogacy and how to best prepare you for that process.
Yeah. And so I would think that during this process, the openness that you need from both sides, right?
Yes.
I need to know a little bit of background. Yep. Is there anything that I need to be aware of? We do a pre-psych evaluation on the agency side just to kind of, obviously check for anything that might arise. But I think the common theme, even as people go through this process, surrogate or intended parent, just being honest and open about your life, right? Because,
absolutely.
Medical records are being reviewed and things like that. So things do come up that you might not want to come up, but unfortunately during this process, we do have to talk about it.
And that's what I was like, please don't forget about parts of your background or your lifestyle, because there's chances are it's going to come back up.
Yeah.
Because I think that almost like when I was in grad school, when I was writing my dissertation, somebody once told me, and I think that it's very applicable here. It's like when you're going through such a personal experience, it's really going to evoke a lot of insecurities. It's going to really bring up a lot of things that you may not want to talk about, but you're going to have to eventually talk about. So I've learned over the years, it's just, I think, more helpful for everybody to get it up and get it out and just be honest and straightforward with what your needs and wants are.
Well, and then that's the best way that we as a whole, professionals and match, that we can move forward where there are no issues that may arise or the clinic might not, request something.
And I say to everybody, we're all a team. We're all joining this to do, we all want to get from point A to point B. We all want a healthy delivery. Surrogate wants to be healthy. Parents want to feel, part of the process. And I just want to step in to make sure that everybody is communicating cooperatively and seeing eye to eye.
Yeah. And we're not here to pass judgment or, fault you for something that may have happened in your past. It's more just, let's see what the issue is and how do we move on.
Correct. And that's what I say, everyone has a past,
Yeah.
It's not a bad thing. Like, it's just, what have you done with it? How have you coped with it, and how have you moved past it? Or is it still a thing for you? And if it is, then we will have to find a way to work with that so that it doesn't become such a big thing for you during that process.
Right, exactly. So from your experience, how do consultations or evaluations benefit the intended parents emotionally, relationship, all of to encompass everything in the journey?
Say that one question one more time. Sorry.
How do consultations and evaluations benefit the intended parents?
I think it gives them the opportunity to be raw, to be vulnerable if they can be, to be real, and to give them the opportunity to say, oh my gosh, okay, so this is how it could go. This is my best case scenario. This is really what I don't want to happen. So I think that it allows the parents the opportunity to feel a little bit more comfortable with this process. It's at the beginning. They don't really even know who they're matched with.
Yeah.
They don't know what the process is going to look like. And so this is, I think, where a bit of my own personal experience, having navigated a surrogacy journey myself, can be really beneficial. A lot of parents ask me,
Yeah.
what is it like? Oh my gosh, and was it successful and this and that? And I don't talk about all of it. I just say that it can be successful, with the right team, and if you trust the process as you move forward. And I think that it requires a lot of flexibility. It requires a lot of mental nimbleness. And, for some parents, I think that depending on their background and what they show up with, that can be a hard one to unlearn, right? Because I
Yeah.
think parents are comfortable in their lives. They're comfortable being who they are. And then they come to a process where they have no control. That can be really, really tough and really, really, really challenging. So part of what I'm looking for in helping people with is getting comfortable with the slight discomfort that it might evoke in you, and what you're going to do with that, and how you're going to cope with stress, and how you're going to cope with anxiety. And we just certainly don't want that to come out onto your surrogate. So it's about creating, pathways for you and your circumstance so that your surrogate doesn't feel that. We don't want her
Yeah.
to feel that at all. We want her to feel supported, whole, and well taken care of.
Yeah. Meeting with intended parents for the first time, I always tell them like the trust and the control are going to be very difficult for you. So, you're meeting with a surrogate for, let's just say, an hour, hour and a half. You've read her profile, and then you meet her, but you're making a decision after meeting somebody. Like you're like it's like dating, right? You're like, okay, hey, I talked to you on the phone for an hour. Let's go out.
It's like getting married, getting pregnant, and then not being able to divorce. You're doing all of life's most challenging things within an hour, sometimes an hour and a
Yeah.
half, and you're like, how am I going to make this choice, and what's that going to feel like, and is it the right choice? And I don't know. And couples have been together for years, right? And they've had lots of time to work through these things. And right now we're saying, okay, Rebecca, I'm gonna marry you, and you're gonna get pregnant with my kid, and I'm gonna trust you. I think I can. I don't know.
Yeah,
And so it's a lot, right?
It's a lot. Yeah.
And there's no divorce, by the way.
Yeah.
There's no divorce. There's no bailing out of this plane. So it's almost
Right.
like part of the analogy that I use too. It's like getting on an airplane, and it's like, well, Rebecca's going to be the pilot. I don't really know her, but she's going to get me from point A to point B.
Right.
I hope.
Right.
And, some pilots are going to let me know when there's turbulence. Some aren't. Some are going to say, get ready, put on your seatbelt. It's going to be a little bumpy. And others are just like, get through it. So,
Yeah.
I think that communication
That's a good analogy.
It's
Yeah.
really, really important. The other thing that I say, to parents, like you said, it's almost like creating a movie, right? It's almost like, I'm coming in and I'm a director, right? And I have a vision and I know what I want to do and I know how I want my movie to go. And I've hired Rebecca, my movie star. She looks great. She knows what she's doing, but I really want to direct her really hard. And I can to some extent, but ultimately I've hired her because I trust her. I know she's going to be able to really shine in this movie. So I say to parents, step behind the scenes. Get behind the scenes. You're not in front of the cameras. Let your surrogate movie star do what she does. I think that's a really nice way of giving her dignity and allowing her the ability to feel like, wow, I really trust this person.
Yeah.
But that's hard for some parents because it's a flip of power, right? There's a
Yeah.
big power differential here because parents oftentimes will show up with a lot of education, big backgrounds, and really high-powered jobs, and just used to getting what they want when they work really hard. But this is an area in life where, despite how hard they work, it just hasn't happened. Whether they're two men or whether it's a heterosexual couple, it just can't happen. So that's where
Yeah.
that control comes in. And so I think it's about helping parents recognize that, I don't want to say power, but for lack of a better word, there's a power differential here. And you're essentially relinquishing a lot of power and putting trust in somebody who you don't really know.
Right.
And so I think that's where the psychological consultation can be really helpful to help parents get a little bit more comfortable with that dynamic shift.
Right. And so on the flip side of that,
Yeah.
you have the surrogate.
Oh, yeah.
And, you work with surrogates who are going through this for the first time, who may be very timid. Education is happening on the background from the agency side, but they're still very new to this process. And then you have a surrogate who's a proven surrogate who may be more like the intended parents, right? Very vocal. I know what I want. This is the type of intended parents I have. So like, how do you navigate, when you meet the surrogate and manage her expectation as well, right?
Yeah, no, it depends.
Two-part.
Right, it's a two-part situation because sometimes, like when I meet couples, they're not matched, right? So once after they're matched, we can have those kinds of conversations. But part of what I'm doing with parents is I'm saying, look, this is sometimes a process of managing risk, right?
Mm-hmm.
Are you comfortable with risk, or do you want to try to mitigate risk as much as you possibly can to some extent, right?
Yeah.
And I think that, for some couples, they're very risk averse. So I say, something, it might be worth your time. You might consider working with a surrogate who has prior experience. Not
Mm-hmm.
that it's going to buy the perfect, complicated pregnancy, but what it certainly can do is help open up the pathway for trust because she's done that.
Mm-hmm.
She's been there before, but however, there's a slight caveat. I do like to see that the surrogate has partnered with the same agency or has the same people in place because they're going to know her very well. It's
Yeah.
like, Rebecca, I've hired you. You've done this once or twice. So, okay, all right. Tell me, could I speak to your intended parents? What was it like working with you?
Yeah.
That sort of stuff. But then there's some people who are comfortable with taking a little bit more risk. Second time surrogates have to start somewhere, right?
Yep. That's exactly what I
They
say.
have to start somewhere. And honestly, sometimes first time surrogates are they're wonderful. Like,
Mm-hmm.
not one is better than the other, but it really depends on the parents.
Yeah.
That's where that level of trust, trauma, cultural background, and nuance sometimes comes in.
Yeah.
And I think that as long as a parent is aware of that, they can then make informed decisions. And that's
Yeah.
part of what the psych consultation is. It's really a humongous opportunity to have informed consent about what is going to happen or what could potentially happen. So they can then say, okay, these are the choices I'm comfortable with. These are the ones I'm not comfortable with. And then
Yeah.
that then allows them the ability to align really well with their agency and with their surrogate, in my opinion.
Yeah. And sometimes it's kind of cool when a first time intended parent works with a first time surrogate and they're all just kind of like
They're doing it
moving
together.
through together. There's no like
Absolutely.
expectation or, underlying, like, I know what I'm doing or
Right.
I've done this before, where maybe she's done it before, but the lack of communication comes in because she's like, oh, I've done this. It's okay.
Correct.
Everything's fine,
Right.
where a
Correct.
first time surrogate might be. So I think obviously on the agency side, we look at that too. Like, okay, what is best for this intended parent? A lot of times it's given also by the IVF doctor. But then you see it on your end after a lot of times after the match has already happened, where it's like,
Absolutely.
okay, here we are, here's together. Here's how we manage.
They're going to need a little bit more hand holding or
Yes.
a little bit more touch points along the way. And again, depending on their trauma, depending on, their grief and depending on all that sort of stuff too.
Yeah.
But I'd say the majority of surrogates that I've worked with over the years are honestly, they're very kind, giving, open people, and they just really want to produce a healthy child for a couple. However, how that looks and how that unfolds doesn't always align with what parents want because their expectations might be unrealistic.
Yeah.
So that's another thing that, I'm assessing for and looking for. Are your expectations realistic, or are they, can anybody meet those expectations?
Yeah. And I think a lot of times that comes in with also the agency having a relationship with the professionals, with the psychologist, where it's like, hey, I have this issue, or hey, I see this in this match. Can we help? Can you help navigate that? Or how do we move forward? Or
Right.
what do you suggest? I think us being transparent as the agency with the psychologist, and just so obviously going into the match, kind of what to expect, or maybe some issues that we see that may arise that maybe you can help mitigate.
Absolutely, or at least bring it to the table in advance.
Yeah.
And then, sometimes, I'm sure you see this all the time too. I'm not in a position to, demise matches. However,
Right.
if that does in fact happen, or if a couple or a surrogate just aren't seeing eye to eye, I'd much rather know that at the first date and say, thanks for the date, but, I think we're going to date somebody else. I'm going to
Yeah.
just, and I say to parents and I remember feeling this myself too. It was, let's go, let's do this. Like we're waited, I'm ready. And then somebody once told me, I think a nurse, a fertility nurse said, Stephen, it's much better to take your time to wait it out and find the right candidates for you so that you can feel much more secure in that process. And I didn't understand it at the time because I was just like, go, let's go,
Yeah.
let's go.
I need to get matched.
Oh, wow,
I need
let's
to,
go,
yeah,
let's
I need
go.
to have a baby.
Right. And then, she was right. She was 100% right because there were things that happened that were out of my control that I couldn't control.
Yeah.
And they just had to happen.
Yeah.
And I think there's some beauty in that because it really opens up the ability for you to really understand what your needs are.
Mm-hmm. We see it sometimes where things are meant to happen or not meant to happen, right? I think there's sometimes in this process, there are things that are just unexplainable, but, sometimes rushing the process or, rushing to have a baby at a certain time or getting matched super quick, it does pose some problems because then we're rushing it and it's like, is this supposed to
Is this
happen?
supposed to
Is this
happen?
supposed to happen
Well,
now, or are we rushing something that's not meant to be rushed? I think, you know, for intended parents going through so much for, let's just say you've had failed transfers, miscarriages, 9 years, 10 years. And like that has been some people's whole marriage,
absolutely.
right? Like just trying to have a
Absolutely.
baby. So I think the sooner the better. But
Absolutely.
there's certain things that can be moved along and certain things you just kind of have
Well,
to let play out.
And I say there's a lot of hurry up and waiting.
Yeah.
Honestly, there's a lot of hurry up and waiting. We're measuring time in months because of the cycles and things like that. And I think that I try to let everybody know that there's beauty in that, and then there's space to continue to grow and evolve and to figure out what exactly it is that you're going to need and want. But it's very hard. Having been a former intended parent, it's hard to be told that. It's hard to be told it's going to take a little bit of time. But having now being on the other side of it, yeah.
Because you feel like you've already given up so much time
Correct.
not being a parent that you feel like you need to
or there's a sense of
minimize,
shame, or that there's life happening around you, or people having families are asking you why aren't you having a child, and it's shameful for some families. It's shameful, or it's embarrassing, or it's hard to talk about. It's almost taboo. People don't want to talk about that. You're in your mid to late 30s, you've been married, why don't you have a kid, that sort of stuff. And it's like, well, these are really personal choices that people don't know. People, they mean well, and sometimes I see that coming up. I have sometimes the privilege of working with people who have been through a surrogacy journey, and then it's good news, right? They have their baby and they're living their life, and they're on the playground, and somebody unintentionally just walks up to them and says, well, where did you get that child? Like, I didn't see you pregnant, and what happened here? And so then it becomes a different kind of conversation of, is it a public service announcement about surrogacy, or do I get into it, or whatever it might be?
Right.
So it's interesting, because it's good news, right? They have their family, but sometimes parents don't want to think about it. They don't want to go backwards. They don't want to think about all the stuff they went through.
Right.
However, I think for the child's mental health, depending on your culture, your background, your views and wants, I think it's appropriate for a child to know about the use of a surrogate. I don't see any shame and harm in letting a child know, depending on your child, of course, getting to know your child, and
right,
disposition, and all
when
that.
do I introduce
right,
it?
And how,
yeah.
and, I've got a lot of strategies for helping people with that too. And I'd say most people are very comfortable and open about talking about surrogacy with their child.
Yeah.
Well, look at gay men, right? There's no hiding it. Like there's just either you adopted, or you went through, like, what happened.
Yeah.
So people are very forthcoming and open about it. And with heterosexual couples, obviously you can pad it a little bit. You can, not talk about it as much. But, I say that we can learn a lot from everybody. I think we can learn a lot from heterosexual, gay couple, and I think that most of the children that I know who have been brought into the world through surrogacy from gay male couples are pretty well-adjusted kids. Because their families are fairly open about it. So
yeah, and we live in a great time right now where I think surrogacy is a topic that a lot of people are talking about, social media and, news. I mean, all of it, right?
Absolutely.
And I feel like if you're an intended parent or even a surrogate, like you're in a good time to have the support of other people.
Depending on where you live in the country.
Correct.
Depending.
Yes.
Yes. I agree with you.
Yes. There are pockets.
There's definitely, depending on where in the country, or in this case, the world, right?
Yeah.
Because there's a lot
surrogacy is not legal.
It's not legal in some countries. And so, there's some shame. So I say to everybody, obviously adjust and do what is in the best interest of your family, your background, your circumstance, your culture, because that's going to dictate, a bit. However, I believe that psychologically children generally are not harmed by hearing about it. I almost view it as like you go to the doctor if you needed a kidney transplant, or if you needed a blood transfusion, or if you just needed a little bit of help along the way. There's no harm, in that.
Yeah.
In asking for help. It's like, I don't have a uterus, but I wanted to have a child. And so, going through surrogacy, I'm not ashamed about it. And I think that, the ethics of it sometimes come up for couples too.
Yeah.
Of, I'm paying somebody for this service. And I'll say, yeah, but the surrogate's choosing to do it too.
Yeah.
Both parties are equally aligned, and they both want the same common goal, And so I think that it's okay. I think it's okay.
Yeah. So evaluating a surrogate is more than just kind of a medical check. Obviously, it's needed for the medical evaluation. But like, what emotional patterns are important for a surrogate to understand before moving forward?
With
so
parents,
just
for when a surrogate's looking to match with a parent.
and like just to understand like emotionally and how the relationship is going to be affected. Like,
Yeah.
what does that look like on the surrogate side?
I think that's such a humongous question, and there's a lot going into it. So, as a psychologist, I'm looking at it from lots of different lenses. I'm looking at it obviously from, her background, where she's come from, her motivations, her, psychology, her family unit, her job. There's so many different layers that I'm looking. Her age sometimes,
Yeah.
divorce, not divorce, support system,
Support,
community.
yeah.
There's so many different factors that lead into this, and I think that ultimately, no matter what surrogate I'm working with, I'm really looking for high amounts of empathy and dignity. And I think that, if a surrogate shows up to meeting with me and I'm, not quite seeing, both on paper and through her background, that there's going to be this ability to treat another couple or a person with dignity, I think then that is a bit of a red flag for me and moving forward with a surrogate. And it doesn't happen a lot. But, some are, and I think that is a huge red flag because in the end, in all the work that I've done over the years with couples and, high conflict circumstances, it's really about treating somebody with dignity, kindness, respect, empathy, and validation. I think that, not to make this a political conversation, but there are so many areas in the world where people aren't treated dignified, and that creates conflict.
Yeah.
And I look at surrogacy to some extent as a mini conflict, and we don't
Yeah.
want that. We don't want that at all. So what I try to do is to try to prevent that by saying, look, if we can work in this pattern, if we can, really lay these, we'll say tools on at the beginning, it can really reduce the potential conflict to come up later on in your experience with your surrogate.
Yeah. Because I come from the surrogate side.
Yeah.
So for me, coming into this process, I felt that I had empathy and I felt like I wanted to do this for the right
Absolutely.
reason. And, I felt like I had support and things like that. And I think a lot of people feel that way, right? You feel a certain way about yourself. And then you come into this process and it's like, hey, how do we make sure that you have empathy and dignity and you have and you're doing this for the right reasons? And
it's a lot to assess. It's a
Yeah.
lot to look for, and I look to their community and what you've done with your life, where you're working, and everyone has a story, right? And I think that as long as the surrogate and her family and her support system are well aligned, then I think that people can generally progress forward. But, every so often things do pop up where I'm like, I think we push the pause for now. Let's push the pause button. Let's maybe work on these couple of things in your background or circumstance. So it's not a no, it's a let's defer for a little bit and then maybe come back.
And then you give them the tools to kind of
Correct. And say, hey, maybe work on this or maybe sharpen this or change that. And then maybe we reassess in a little bit of time.
Yeah.
But maybe now is not the right time for you. And I look at it, not that I'm the end all be all here, but I try to look at this experience as a safety measure for everybody.
Yeah,
For the
no,
surrogate,
absolutely.
For the parent, for the age, for the baby, for everybody. And so when I begin meeting with surrogates and even families to some extent, I always begin by saying, look, I'm not here to judge. I am here, though, however, to provide an assessment, but it's really for your safety. Try to look at it as a safety experience because nobody wants anyone to be put in a position of feeling unsafe or, to feel victimized or to feel like they're, not able to succeed. So sometimes if somebody is unable to move forward at this time, it's purely, in my experience, just a safety experience for everybody. We don't want anyone to feel hurt or exposed.
Yeah. Well, and it's more than just, okay, where do I come from and how do I feel about this process? It's like, also, how do I work with a couple and have their child, but this is their child who I'm allowing to make decisions for that child. So it's very deep, right? We don't think about it. I think when a surrogate comes into the process is, I want to have a baby for someone. I've had great pregnancies. I've always wanted to help a couple. And then it starts to get real deep.
Well, so what I say is to parents, and part of what I'm assessing for and what I'm looking for is, I say to parents, look, guys, we're in the theoretical stage of this conversation. It's all theory. It's all, we're talking.
Yeah.
And the minute that your surrogate hopefully gets pregnant, it transitions to something very real. And for many couples, they've never experienced a pregnancy before. So everything gets really charged.
Because hypothetical.
Correct. Because it transitions from hypothetical to real. And oh my gosh, how do I don't know how I'm going to feel and I don't know how I'm going to cope with this. And then
now I'm anxious. And
correct. Well, here's an example. Sometimes there's an underlying distrust of the American medical system or just OB care or whatever it might be. And parents might arrive saying, I don't want my child to have any exposure to anything in utero, nothing, eat this and don't do that. And you must have to, okay. Or I understand that. However, the surrogate does have autonomy to her body, and she does have the ability to make choices for herself. And sometimes that can be a minor conflict or a major conflict,
Yeah.
depending on the person, what their culture is, their background, or what they're arriving to the surrogacy journey with. So part of what I'm doing in the group experience is bringing up these things that I've learned over the years to help manage that.
Yeah.
Or just say, hey, look, if a situation like this comes up, let's talk about it. What might we do?
Yeah. And I think on the agency side, this is very important at the beginning of a journey, let's just say matching. My suggestion is always to, you know what, if there's something you feel really strongly about, something that's maybe not listed in the profile, maybe a question that just didn't get answered, that you just feel really strongly about, like you said.
The political background. Like
Yeah.
that was a new one for
Yeah.
me. Hey,
Or like, what do you eat?
Yeah.
Hey, we really want you to eat this. Oh, we don't like these cleaning products. We want to use these clean
nail salons,
nail
hair
salons.
salons.
I've heard people say, would you be okay using all natural makeup?
Absolutely.
I think before you get into a match, because obviously the goal at the match in the match meeting is to make sure that you align, you can vibe. We talk about very, non-fun things like
course.
termination and things like that. But I think these small things that come up sometimes later down the line, like you mentioned, once a pregnancy is concerned, where they don't think about
They
it.
fester, and it's almost like a relationship. So we want to try to reduce the amount of resentment and angst at the beginning.
Yeah.
So we want to put more positive pennies in this piggy bank of well of experience to really say, this is the right person for me. And there's all these little things that pop up.
Yeah, and it's like just ask the question. Like, I'm happy to
What do you do in your
copy and
free
paste.
time?
Yeah,
Yeah.
copy and paste hey, would you mind eating this? What kind of cleaning products to use? Things that, let's just envision that you're pregnant, that you're now having a baby. What does that look like? And I try to explain to also to the intended parents, like 80-20 rule for diet, because I think these things in your brain, you could really start to snowball.
Like I said, from theoretical to real. And
Yeah.
then it becomes, I've never been pregnant. Then sometimes we struggle, or parents struggle with, am I going to bond with this child? And how am I going to feel? The baby's not, specifically in my body. And that's a real, I get it. It's real. But, I in jest say, something, I don't have a uterus. I'm never going to have a uterus. I'm never going to know what it feels like. But it doesn't mean I'm going to love my child any differently just because the child was in somebody else's body.
Yeah.
And oftentimes, in my experience in psychology, attachment really begins afterward. Attachment is something that people work on, and it's something that you feel. And, attachment, it's possible it can begin in utero, but it's also possible that it can begin once the baby is born too. And so I try to assess and work with families too.
Yeah.
Going back to what you asked earlier about parents, how they're arriving and where they're at psychologically and how they're going to feel about bonding and, nurturing and creating a sense of, I'm going to be a parent now. Wow. When do I get excited? That's something that, we talk about too. Do I get excited the minute she's pregnant, or do I get excited once the baby is born and in my arms? Very personal question. Years of trauma, hurt, loss, and it's hard to predict when, somebody might feel bonded or excited because they're guarding, right?
Absolutely.
And I think part of, being a parent on the other side of it too, to create rituals and to feel like you're experiencing this process too, but, culture sometimes plays a factor, superstition sometimes, when do I do that? That's a really hard question, to answer because it's so personal to every single couple. And I think that depending on how the consultation goes, sometimes I make the recommendation for, I think you might benefit from having an additional consultation, either with me or with a different provider or somebody of your choosing, just so that you can begin to talk about these things so that as you're going through the process, it's not shocking or discomfort or uncomfortable for you, that sort of stuff. Because remember, we want you to be whole and happy once the baby's here. We don't want you to feel disjointed and disconnected. But again, that trauma is very real, and it's really, really hard to predict how it may come up.
And then the emotional or maybe non-emotional side, depending on the surrogate, at delivery.
Absolutely.
So
There's
envision yourself,
happening.
you're, about to deliver the baby, and what does that look like for you?
Are you there? Are you not there? Do you prefer to be behind? Does the surrogate want you there?
Or just the surrogate delivering? Like, how does that look like for you as a surrogate? Like, you're delivering the baby, and like, okay, now you're giving the baby to the parents. Like, are you mentally okay with that? And what does,
Are you preparing yourself for this gift? And you know what I say to all surrogate, part of, when I meet with surrogates, I'm like, this is my absolute new favorite way of viewing surrogacy. I have so many different things. I'm like, it's almost like you're serving as a kangaroo, a koala bear, an oven, a panda bear, the reverse of foster care, where I
Yeah.
really think it's important for a surrogate to tell herself at the beginning, look, this baby that I'm carrying already has a loving, stable, supportive, nurturing home. I've been asked and tasked with being a foster parent, but it's in the reverse order. In the
Yeah.
traditional foster care, kids are, born into challenging homes, right? And then they have to find love and stability and all that good stuff. But in this case, it's just the opposite. This baby already has it, and the family is going through extreme measures in order for that family or that child to be introduced to that family.
Yeah.
So I try to encourage surrogates to think about that. And I also say, here's my new favorite one, talk about, the day and time in which we live. I'm like, listen, you're acting as a 3D printer. This family already has some feedback. They're going to say, here, take this, and you've got that 3D printer inside your body. Could you grow this for me?
Yeah. I
And
love that.
Yeah. So surrogates usually like that one. Their kids like it. They have a good time with it too. But I also think, you could probably speak more to this, but psychologically, I would assume for a surrogate, it can be a bit challenging, right? Once you deliver, there's a change of hormones and so what I say to surrogates, I think it's really important to go towards something after you deliver, pre-plan something. I think that, it's not
No
so much.
vacation or
Yeah, but it's not for me. Well, again,
Yeah.
you correct me if I'm wrong, but it's not so much about missing the baby, but it's about missing the experience. Because if it is a successful experience, I think that surrogates will miss all the support and the feedback and the nurturing relationships that they've grown with the family if it's a good match, right? With their case manager, with the people that they've helped, and all of a sudden, oh, they're gone. I mean, you want that, right? You want that family to be
Yeah.
created. You want that family to be happy, but yet, who am I? I'm in the hospital, and baby's gone. Family's doing their thing, and how do I fit into that?
Yeah.
And so I think it's really important for a surrogate to think about that. And you tell me if I'm wrong.
Yeah, no, exactly. I obviously didn't want the
Yeah.
child, and I think a lot of surrogates come into it like,
Correct.
look, I don't want another
Right, right.
baby. I'm done having my own kids. Like, I don't want your baby.
Right.
But I also love this experience.
Yes.
We've had this bond. I
Yes.
was actually more sad to not see my intended parents
Correct.
every day than I was
Correct.
it all being attached to
Right.
the children. Like, it was more like, gosh, I love my couple, and I like have had this relationship with them for
You dated
a
and
year and a
you got
half,
married
18
for-
months.
yeah,
And now
absolutely.
it's like, now they're going to go home, and I'm going to see them, once a week to give them
Yeah.
breast milk. And, so, and we still have a relationship to this day, and that always doesn't happen, but I'm thankful for that. But I would say that's probably why a third of surrogates come back and do another journey
Absolutely.
very quickly afterwards.
And we have to say, look, it may look a little different,
Yeah.
but it's about the experience because it is so powerful and life-changing. And I say, no matter where you live in the world, you will be bonded to that. I mean, that person will
Yeah.
have forever changed the world for you. I say to surrogates too, it's almost like, it's not very often that you can change the world, but in this application, you literally are changing the world and opening the world up for that family. You legitimately,
Absolutely.
there's no taking that away from you. And that's something that no one will ever be able to take away from
No.
you. It's something that you can carry with you for the rest of your life.
Yeah. Even if your journey wasn't what you expected or it wasn't perfect or things like this, I always tell myself, I don't need the validation of anybody else. I know
You
that
did
I
it.
did it, and what I gave to the world is more than anybody can say thank you or gifts or any of it.
Absolutely. And
You just have
that's
to know internally that you did such an amazing thing.
you've given the gift of all gifts, basically.
Yeah.
That 3D printer was a very powerful gift that you gave to somebody.
Yeah.
The ability for you to use that selflessly, absolutely. And I
For
think
sure.
that, whether you have a relationship or not with the child or the family afterward, that's a bonus. That's, an amazing thing.
It really
It doesn't
is.
often happen that way.
Yeah.
But it does.
Yeah.
But again, no one will ever take that away from you. It's
Yeah.
like getting a degree. No one could ever take that away from you.
Yep.
It's something that you've earned. You put your hard work in. Yeah, that's the other thing, with surrogacy. And I say to parents too, I'm like, this is a marathon. It's not a sprint. It's an everyday, we're going to show up every day. We're going to, work collaboratively
Yeah.
for the surrogates too. And I try to, when I'm meeting with surrogates, I try to help them create the realistic expectation of, look, we really have no control over what's going to happen and how the pregnancy is going to unfold. We hope that it's healthy and we hope that you deliver. But honestly, what you full have control over is yourself, your choices, your stress levels, and your ability to, show up every single day and live your life to the best of your ability and make good, healthy, smart,
Yep.
rational choices. That is what surrogacy is about. And I really think that, I hope at least it helps surrogates in preparation for, if there were to be a miscarriage or some medical complications or challenges that can happen, because
Yeah.
I think psychologically it's more important for her to know that, every day that I showed up, I made a good choice. I
Yeah.
made a smart, healthy choice. And
I
that
did my job.
I did what I did what I came to do. And ultimately it's hard because you want to sort of detach from, the delivery, right?
Yeah.
But everyone's doing it for that. But yet the realistic, application of surrogacy in my experience is just every day.
Yep.
Make healthy, smart choices every day. Did I do this? Did I, that sort of stuff.
Yeah. It's a job. So,
It's yeah,
yeah.
it's a beautiful meshing of
Yeah,
a
it's a
job and
beautiful.
your personal, and
Yeah.
it's gonna feel. And that's what I say to parents too. And I think about parents, and I'm meeting with them, and I'm like, okay, are they in charge of their lives? Like, what do they do? It's gonna feel a little like a twisted combination of both work and personal at the same time, and the way that you mitigate, solve problems. It's gonna sort of emulate either what you do in your personal life or in your work life, and it's going to feel twisted, because you're trusting, your movie star here with a child that you can't do on your own for whatever reason. And
Right.
yet I don't want to say is in charge, but ultimately she is the one who's leading the pathway here, right? And again, for many parents, that can be a very big power differential.
Yeah.
So,
So let's kind of go
yeah.
into the stressors
Oh, yeah.
of surrogacy. So what patterns do you often see that create tension and stress between intended parents and surrogates if not addressed early on? So obviously you're going through the process. There are things that come up that maybe you probably weren't thinking about, right? But then something happens and
Yeah.
the stress or the tension comes up. What could we have done maybe early on to help address those things that come up later in life?
Right.
We talk about communication.
Yeah.
That's like the foundation, but you are obviously seeing it on
It's a complex,
much higher
right.
level.
It's a complex question because, we don't have a crystal ball, right? Nobody can predict whose lifestyle is going to take twists and turns, and job losses and job insecurities, or how,
Yeah.
kids get sick. There's so many different factors that can come up, right? It's a person's life, it's
Yeah.
another human being. And so hard question to answer, but I think that drawing on all of the experiences from either the psychologist side or the agency side and saying, look, parents, these are the different areas that potentially we've touched on some of them.
Yeah.
Communication's humongous. Absolutely. Diet, lifestyle, religion, culture, background. I think that complex medical choices sometimes doesn't really get talked about on your first date, because who wants to talk about that?
Well, and we
But
don't know, right? It's that
correct.
hypothetical
It's-
situation. Am I going to have an issue where I go on bed rest?
And-
So these are
Or do I have to take this medication? Should I take it without telling the parents, or do I just do it on my own and then tell the parents? And honestly, in that specific application, I think that it's about when a parent doesn't feel consulted, they're just fear. It's fear, it's concern. And, I try to mitigate that with the parents by saying, look, the OBs are going to, I hope, do what is in the best interest of not only the surrogate's body, but your child as well. It may not align with what your needs and wants are, but they're in the business of a healthy delivery and a healthy baby, right?
Yeah.
And it may look different. And that's where that cultural piece sometimes comes in, or a distrust for the American system of medical care, especially if an IP is in another part of the world. That sometimes can pop in, or vaccines, another big one.
I was going to say that. Yeah, vaccines.
a big one. During the COVID crisis, that was a
And a lot of times it still it still comes up obviously for ones further down the line.
absolutely
Not so much anymore COVID, but yeah, I
Just
think
anything. Flu is
just
a big
anything.
one.
Yeah,
Here's
exactly. Any medication you're going to take Tylenol now
Absolutely.
is
it's a huge
so
one. Or like drink water from the mountains of Iceland in glass, and that's fine as long as it's addressed. But I think that diet, lifestyle, exercise, access to food, for some families, eating a particular style or way is very important, and I try to work with parents. I say, look, I think that's appropriate to talk about. However, please don't set your surrogate up for a power struggle. If you yourself wouldn't keep that particular lifestyle, I think it's unreasonable, and it's setting her up for a struggle that she may not be able to keep. But if you personally do it and you live that lifestyle, align with her, talk to her about it. She
Yeah.
may not be the right candidate for you, and you'd much rather know that at the beginning. And then, sometimes in local matches, it's interesting because that's where this power differential sometimes comes up, where parents want to have access and get in there and be to every single thing. And that's great, right? But surrogate's the patient. She's the one who's in charge, right? She's got her HIPAA right. She can say, no, you're not allowed in there. So we try to talk about that too. Who's going to have access to, to seeing what's going on in those appointments. Is it going to be her feeding you the information, or are you going to allow the parents to have access directly to the doctor if the doctor, if you sign off
Yeah.
on the release of information for the communication to happen.
And so on the agency side, I see the stressors and the tension, that situation, obviously, to try to help mitigate that, we do make sure that every single match has a group session,
Yes.
which we really haven't chatted about
Oh,
yet.
it's
It's really
so
individual at this
important.
point, but a group session is key for both
I
sides to meet.
I believe, yes,
I
I
believe
believe.
too. I think really, this is something that has evolved in the industry
Yes.
over the last few years of, before it was East Coast, West Coast,
Yeah,
East Coast clinics, it was mandatory, not so much on the West Coast.
correct.
And then, we just kind of adopted the group session as being critical
Mhm.
and making sure the surrogate and the intended parent can come together in a group session with a professional to say, okay, here's me, and how do we successfully move forward?
It's another checkpoint, right?
Yeah.
And it's about setting the frame at the beginning. It's almost like, when I do these group sessions, which by the way, I absolutely love doing, I find them to be incredibly beneficial, useful for every person. And most of the sessions I've had at the end, people have said, something that was really, really, really useful. I'm hopeful that you have the same experience with
Yeah,
parents. It's very
nobody's ever said anything
negative,
negative
right?
or that they didn't get
Get
out what
anything
they
from it,
thought
right?
because, I just think you're meeting for an hour and a half, you're moving forward with a match. Your surrogate comes from somewhere and you come from somewhere.
Hmm.
How do we meet in the middle for this to be successful? And I think those stressors and tension that come up throughout the journey, maybe you go back to that and you say, you know what? I know that this is who she is and this is where
I,
she came
right,
from.
and I put people not intentionally. I lay these little like bombs and just to say, hey, if this were to happen, how are you going to manage that, or what's this going to look like? And then we kind of
Hmm.
work our way through, baby scenarios, baby little like conflicts to see what happens. The goal is to not undo a match, of course. However, if that does occur, it's much better, obviously, to know about it in advance. But ultimately, the framework is to, set the framework at the beginning. I use almost like a round robin style check-in, kind of draw back to my group therapy
Yeah.
days of like, okay, and how did you feel at that? And what did that make you feel? We really revisit all of those things. We talk about shared values and the logistics of what the pregnancy is going to look like, those
Yeah.
medical choices. We try to create a map for each other's needs,
Okay.
to say, hey, these things could come up. This could trigger anxiety. This could make you feel underappreciated, overappreciated. What does communication look like in these moments? And then we spoke about this, but trying to normalize the power asymmetry here, I think that's really, really important too,
Mhm.
because you're each very much in charge, right? No one's leading the charge here. You're
Yeah.
both on the same team. So it's about trying to normalize sometimes that unspoken tension,
And
that
just being respectful, just like
absolutely,
what I want to feel like this, or if someone said this to me, how would I react to that?
absolutely.
Everything is, I would say a lot of communication happens by text, which is good and bad, right? It's good because it's a quick message where you get a response, but it's also very black and white and can be taken out of
Well, what
context.
happens is psychologically people infer
Yeah.
their stuff onto
Yeah.
text. So I say to everybody, look, for just April 5th, that's my appointment, 10 o'clock. Wonderful. But if you have to communicate more nuanced information, please pick up the phone.
Exactly. Yeah.
You will
Yeah.
get so much more from the inflections and the tone. So yeah, it's about talking about those power asymmetries and trying to talk about sometimes that unspoken tension, because
Hmm.
again, part of what we don't quite know is, has this couple and this person, this family really, really come to a place of acceptance of working with a surrogate? So sometimes we're still dealing with, that trauma. Baby's
Hmm.
not going to be in my body. How am I going to feel about this? And so it's about, in my experience, the further along a person or a couple is in accepting, either due to medical reasons or, whatever else comes on, I don't have a uterus, whatever. It's about, have I fully accepted this? And I think
Yeah.
that alone can set a foundational, a strong house, right, if you will, because they will say, well, there's no other way for me to do this besides adoption. I try this, or, we make the choice to not have children, and that's okay too.
Yeah.
But I think when people are struggling with that, I should have done more, I could have done more, and why didn't I do enough? And my body failed me and it let me down and I'm a disappointment. Those are very real, valid feelings, and we
Yeah.
want to honor that. Though I would say to a couple, if you're still actively struggling with that, I might encourage you to take a little bit of time to process that before you choose to work with a surrogate, because those are the I think like the tinder that could cause
Yeah.
tension. So
And
yeah,
s- and so let's just say maybe a journey isn't going
yeah,
well, right?
yeah,
In one of those, but well, I don't want to say worst case scenarios, but harder situations.
yeah.
What is your role or a psychologist's role further down the line? Like, is that something, you're available? They can, have one-on-one sessions. Maybe
Absolutely,
we regroup and
absolutely. You know,
at the 20-week mark, let's have another
yeah,
group session and see how we get through to delivery.
absolutely. And every couple, every match is very different. I think that part of what I sometimes struggle with in surrogacy or just, being in this industry is that there's a lot of work done at the beginning and then we hope for smooth sailing.
Yeah.
We
Right.
hope, right? And so, I feel like as the industry continues to evolve and as we learn more about and it becomes more talked about, I think that whether it's a psychologist or an agency, I think there needs to be more touch points throughout this journey. And I think that whether it's, on a curated basis, a case by case basis, or what agencies see where the general stress levels are,
Uh-huh.
we say, hey, you know what, we're going to invite you in to have a meeting with a mental health provider or come into whatever it might be.
Mm-hmm.
I don't think there can be any harm,
Absolutely
in
not.
touching along the way. So to answer your question, I think you specifically asked, what was your question specifically?
Like down the line, like
Yeah.
how does a psychologist, like what's your role?
The role would ultimately to continue to make sure that everyone's seeing eye to eye, communicating clearly, feeling that your needs are being validated and heard and respected. And if you need more from your surrogate or even less of, first of all, I've never heard a parent say I need less.
Yeah.
I've never heard that. I've
Yeah.
only ever heard, so when I'm meeting with surrogates, I say, in a lot of cases I've ever worked, I've never once heard a parent say, my surrogate's talking to me too much. What does she want? No, I'm not going to. Never. So
Never.
never. So I say to surrogates, lay it on. The more the merrier. The more you can do,
Yeah.
obviously do it. I think that the parents would really appreciate that. And that gets into that well of reducing anxiety. And it makes the parent, in my experience, feel a lot more confident and comfortable with the surrogate that they've chosen,
Yeah.
aside from the pregnancy, just as a person.
Right.
And I think that's the other hard part that it's like you're trusting her as a person, but as a professional pregnant person. And what does that look like? Right.
Yeah.
Everyone has a different lifestyle. People are going to make different choices. But again, we're all trying to get from point A to point B as healthy as possible. As long as she's daily making healthy choices, then this process, I hope, will unfold the way that everyone most desires in
Yeah.
healthy delivery.
Right. And on
But
the agency side too, sometimes, the agency is the one who's managing the cases, right? So I think sometimes there are situations that arise where, maybe it's a suggestion, what, I really think you should, speak to the psychologist to try to manage this, right? Because sometimes it's a little out of the scope of the agency's.
yeah, and it's oftentimes
We're
conflict. It's what we've been
correct.
talking about. It's
Yeah.
oftentimes conflict or just not feeling heard or validated that, my needs are important here, or I don't really appreciate that the surrogate, is I don't know, having a cheeseburger, for example,
Mm-hmm.
and okay, well, we can talk about that. And maybe she absolutely, her kids were starving and she had to stop somewhere and she was,
Mm-hmm.
maybe it's not an everyday thing because we just don't know, where people's mindsets go as well,
Yeah.
and so,
Yeah, for sure. And so if you meet with somebody
yeah.
that is maybe higher
Yeah,
anxiety, things like that, do you suggest, maybe
I
regular
do. I
sessions and
do. I say,
okay.
something I think that, ultimately it's your choice. I'm not mandating or saying you must do this. I say, but, I think that might you be open to the possibility of additional support, whether it's
Yeah.
with me or a person of your choosing or, somebody that you trust or anybody. I think that, you know, for some couples and for some peoples it's shameful and they don't talk about it or it's very insulated just to them, right? And they
Mm-hmm.
don't have a big support system. So that's another thing, that I'm considering when I'm working with couples is, do they have people to talk to? Do they want to talk about it? Is it shameful? Are they open about it? And so obviously, if I have a meeting with somebody and, they're struggling and,
Mm-hmm.
I hear a lot of psychiatric stuff and traumas that they've been through and they're crying and their expectations are, we'll say, not realistic, then absolutely I will say, hey, something, let me talk to the agency or let me reach out, on your behalf.
Yeah.
Let's create a plan for you here so that we make sure that you are well taken care of, or maybe we push the pause button just for a little bit and get this handled a little bit better.
Mm-hmm.
Again, safety, right?
Right.
Safety for the family, safety for the surrogate as well, because we don't want the surrogate to be exposed either, to a
Mhm.
family's unrealistic hopes or expectations either.
Right.
So that can be really hard for a surrogate too. She's coming in blind, right?
Yeah.
She's saying, "Well, I'm doing this. I want to have a baby for them, but I don't want to be, subject to stuff, right?"
Yeah. Well, the surrogate is coming in as I want to give someone a baby and doesn't usually have very many questions
Right.
and is pretty open to who she's willing to carry
Yeah.
for the most part.
Yeah.
That denying an intended parent profile is not fairly common,
No. Right.
because they're
Right.
just like, no, I love everybody, I want to help, a
Right.
family have a baby. But on the intended parent side, it's obviously much more
It's deep.
detailed.
Yeah. It's
So
deep.
yeah, I think it's just the difference in your mental just thoughts coming into this and where everybody stands, where
Yeah.
one is very low and one is very high. And
It's hard. It's hard to make those assessments, early on, and things evolve, right? Like I
hmm
said, once it goes from theory to real, things really start to kick in. And,
Yeah.
the hope here, though, is that, a parent has some time to get to know that surrogate, get to know that person, get to know a little bit of their background, their lifestyle, all that kind of stuff. And those are
Yeah.
questions that I think are important for parents to consider. Some parents are very busy, right?
Yeah.
Some are super busy and they're like, look, I don't have a whole lot of time to create that kind of relationship. And that's okay.
Yeah.
As long as they're aware of that and they know that at the beginning and they're like, okay, I can get through this 9 months of fine. We'll just
Yeah.
talk every so often. Great. And some surrogates are like, look, I want to have a best friend. I want, to really get to know that. I want to feel like I'm making a meaningful difference, an impactful difference in this person's life. And
hmm
so for their mental health, I think it's important for them to match with the right couple too.
Yeah. That comes in the early
Yeah.
stages of
Yeah.
matching to make sure that everybody aligns
Yeah.
on that.
Yeah. And things shift and evolve, right?
Well, and you don't know sometimes if you
Yeah.
want to be a best friend because you don't even know these people and they don't
Correct.
know you. And so it's a very hypothetical. I can understand being in the middle of like, I want to vibe naturally. And if it becomes a best friend, great. And if it doesn't, that's okay
That's
too.
okay
We're
too.
respectful of each other.
Right.
We all came in for one end goal of a baby and
We're
we
making a
go our
movie.
separate.
We're
Yeah.
making a movie. I've hired my movie star. We'll direct, you star, and great. And then we'll revisit that movie every so often because we enjoyed it, or we won't. That was
Yeah.
not a very good movie. And so I talk to parents about that, and they usually can get behind that and say, "Oh, okay, all right, I get that. All
Yeah.
right, cool."
Yeah. That way there's not like a very high expectation of what
No,
to expect
no,
after.
right.
Yeah.
And it's kind of lowering those expectations, but creating a realistic expectation.
Yeah. So if there were three
Oh
things that
boy.
you'd want every intended parent to know about the emotional side of this journey, what would they
Oh
be?
boy.
Just three. Just
Oh my
three. I know
gosh,
there's
there's
so
so many.
many. I
There's so
know.
many. I would say take your time at the beginning. I think that really curating the kind of experience that you think you want at the beginning can be really helpful. So I want you to think about all those factors of dating, what kind of lifestyle and personality and where she lives and how, I want you to think about who you want to date. And if it takes a little bit of time, great. And if you're a couple, I want you to really, go in separate rooms and I want you to jot down all these characteristics that are important for you and then come back together and then try to have that conversation and then say, these are the things that we're looking for in a surrogate. So I'd say take your time at the
Mhm.
beginning. That's the
It's a
first
great
one.
one. Yeah.
It's just take your time. And we talked about, people are and they want to do it quick. Take your time. I think that like choosing a life partner, right? Some people make choices really
Yeah.
quickly, and some are a little bit slower.
Sometimes it works, sometimes it doesn't.
Correct.
Yeah.
So in this case, we want to take a little bit more time. Okay, so take time. The next thing I'd say is to be psychologically flexible and to have psychological nimbleness, and to expect that things aren't going to evolve and unfold exactly curated to the way that you want them to be, but that's not bad. As long as it's falling within, we'll say, it's like driving.
Yeah.
You're gonna swerve a little bit, but as long as you're staying within the lines, be flexible. Try to be flexible. I think the more you can be flexible with your surrogate, the process, and adapt, I think it's going to help create a feeling of, say, safety.
Yeah.
Right? And the last one, I think you can have fun, and I think that creating. I say this to a lot of couples. I really want you to keep a journal. I think it's important to chronicle and to journal the experience,
Yeah.
good, bad, not so good, because you know what I think it does? I think that it's a beautiful love letter that you're essentially writing to your child. And I think that you can revisit it in a year, 2, 3 years from now, and then share it with them. Because sometimes what we haven't talked about is some parents ask me, well, do I talk to my child about surrogate, and what do I do and do I not? And I think that if you put a little therapeutically, I think it's really a good tool
Absolutely.
to keep this journal and to write thoughts and questions about what you think your child's going to ask you or why you're doing what anyway, all that. So I think it's good for the parent. But secondly, I think it's just it's a love letter. It's a book. It's something that you've put together and you can revisit it and your child will go say, great, I want pizza. I don't really care. Doesn't really matter. But more importantly, it's the ritual. I think that's what I'm trying to ground people toward is the ritual, going through it and feeling like you have some attachment. And then not only will you have, I hope, a healthy baby, but you have this other document that you
Yeah.
created, and it's a live document that you can share with your child later on. Whether you use it or not, it's irrelevant, but the fact that you've done it, I think already steps into, the role of being a parent.
Yeah. I love that. No, those are great. Those three are great.
I mean, there's so many. It's hard to choose.
I know. That's why I was like,
It's-
okay,
it's-
he's going to be like all,
It's hard to choose.
I will say journaling, I think in general, even on the surrogate side, I journaled during my surrogate journey, even just to go back and look and be like the emotions that I felt and things like that. I think sometimes, life can feel overwhelming. You're dealing with your own life and whatnot. But just to touch on that a little bit, I think it's good for both sides just to, get out your feelings. You're taking meds and you're doing all these things. And so I did it, kind of started it for like a med journal. And then it kind of just like
Absolutely.
evolved into, oh, you know what? I'm just going to write all my feelings down and, just,
So
putting it
helpful.
out into the universe
So
of
helpful.
this is going to work,
So helpful.
Yeah.
We live in such a technologically advanced, culture these days, and that's fine. If you'd rather type it, fine. But I think that there's something therapeutic about picking something up and writing it down. I don't care if you start drawing a picture. It's just
Yeah.
something that you can do. I think it, like I said, it provides a lot
It just
of
gets it
grounding.
out of here and on here, and then you can just, release it.
Absolutely. Or revisit it later.
Yeah.
If you're having an anxious day, be like, what I say to people in therapy, it's like, try to get that thought out, write it down, look at it for about 10 minutes, and then put it away. Say that is gone now and go to the next activity.
Yeah.
And then maybe you revisit it in an hour or two. And oftentimes what you might find is that thought isn't as big or scary or as uncomfortable. So I think it can
Absolutely.
really just reduce it
Yeah.
and create a little bit of sense of control over something that can feel a little bit out of control.
Yeah. I love that.
Yeah. I mean, there's so many. I could talk all day about it.
I know. Okay, so just to
Yeah.
conclude,
Yeah.
what would you say to somebody who's about to go through this process that's feeling anxious or maybe, emotional or, just the complexities of this journey? What would you say to them?
Boy, I would say, really revisit why you're choosing to do this and trust this process. Trust that, people have been there ahead of you. You're hiring a team. Trust that team is going to get you from point A to point B as safely and as quickly and as, I don't want to say flawlessly, but as to the best, as best they can. And that, accept whatever is going to happen in advance is what I'd say. I think that alone can provide a lot of grounding throughout this process. I think that not losing sight of your lifestyle, your choices, your social relationships, and trying to still live your life is incredibly important because I think that many couples, because there's such a vast amount of money, hope, fear, excitement, hurt, want, you name it, the gamut of emotions, it's all kind of laying on this. Right?
Yeah.
And that's a lot for a surrogate, to take on too, right? And so
Yeah.
we haven't even touched on that. But I'd say accept whatever the outcome is in advance. And I hope that can reduce some of the anxiety. And then reach out, you're not alone. There's people who've been there, they've done that. There's psychologists who have been there, done that themselves, or family members or friends or people in your agency oftentimes can really help you.
Yeah.
But you don't have to do it alone. I think for some couples, the shame is pretty significant, and they're afraid to talk about it, based on where they live
Yeah, right.
or whatever it might be. And it's okay to have a trusted person to talk to. Somebody who's neutral is not going to judge you and just allow you the ability to get it out. And, maybe it's just, I don't like the shoelaces she's wearing. It's making me uncomfortable. Okay, it's whatever. But as long as it gets out, I think it can make somebody feel really grounded and supported.
Yeah.
So, there's so many. But
I love that. Okay, well, with that, Dr. Covelluzzi,
right.
thank you so much for joining us today. Thank you all for joining us on the Surrogate Buzz today and chatting with Dr. Covelluzzi about the psych process. This has been very educational. I hope you guys feel the same. Don't forget, like, subscribe, and comment, and we will look forward to seeing you next time.